Blood clots are clumps of blood that form when your blood thickens and sticks together. They can occur anywhere in your body, but they are more common in your legs, arms, lungs, and heart. Blood clots can be life-threatening if they block the flow of blood to vital organs or cause complications such as stroke, heart attack, or pulmonary embolism. That's why it's important to know the warning signs of blood clots and seek medical attention as soon as possible if you experience them. In this video, we will share 8 common symptoms of blood clots that you should never ignore and what to do if you have them. So let's get started. 1. Swelling in one leg or arm. One of the most obvious signs of a blood clot is swelling in one leg or arm. This happens when a blood clot blocks the vein that carries blood back to your heart, causing fluid to build up in the affected area. The swelling may be accompanied by pain, tenderness, warmth, or redness. You may also notice that your skin feels tight or stretched over the swollen area. If you have swelling in one leg or arm, you should elevate the affected limb and apply a cold compress to reduce the inflammation. You should also avoid putting pressure on the swollen area or wearing tight clothing or shoes that may restrict blood flow. However, these are only temporary measures, and you should see a doctor as soon as possible to get a proper diagnosis and treatment. 2. Chest pain or shortness of breath. Chest pain or shortness of breath can be signs of a blood clot in your lungs, also known as a pulmonary embolism. This is a serious condition that can be fatal if not treated quickly. A pulmonary embolism occurs when a blood clot travels from another part of your body, usually your legs, and gets lodged in one of the arteries that supply blood to your lungs. This can prevent oxygen from reaching your lungs and other organs, causing damage or death. If you have chest pain or shortness of breath, you should call 911 or go to the nearest emergency room immediately. You may also experience other symptoms such as coughing up blood, rapid heartbeat, dizziness, fainting, or sweating. Do not try to drive yourself or wait for the symptoms to go away. You need urgent medical attention to dissolve the blood clot and restore blood flow to your lungs. 3. Severe headache or vision changes. A severe headache or vision changes can be signs of a blood clot in your brain, also known as a stroke. A stroke occurs when a blood clot blocks an artery that carries blood to your brain, depriving it of oxygen and nutrients. This can cause brain cells to die and impair your ability to speak, move, think, or see. If you have a severe headache or vision changes, you should call 911 or go to the nearest emergency room immediately. You may also experience other symptoms such as weakness or numbness on one side of your body, slurred speech, confusion, or difficulty swallowing. Do not try to drive yourself or wait for the symptoms to go away. You need urgent medical attention to dissolve the blood clot and prevent permanent brain damage or death. 4. Abdominal pain or vomiting. Abdominal pain or vomiting can be signs of a blood clot in your abdomen, also known as mesenteric ischemia. This is a rare but serious condition that can cause intestinal damage or death. Mesenteric ischemia occurs when a blood clot blocks one of the arteries that supply blood to your intestines, causing them to become inflamed and swollen. This can lead to severe pain, nausea, vomiting, diarrhea, or blood in your stool. If you have abdominal pain or vomiting, you should see a doctor as soon as possible. You may also experience other symptoms such as fever, bloating, or weight loss. Do not try to self-medicate or ignore the pain. You need medical attention to diagnose the cause of your symptoms and treat the blood clot before it causes irreversible damage to your intestines. Before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. 5. Leg pain or cramps. Leg pain or cramps can be signs of a blood clot in your leg, also known as a deep vein thrombosis. This is a common but potentially dangerous condition that can lead to a pulmonary embolism or a post-thrombotic syndrome. A deep vein thrombosis occurs when a blood clot forms in one of the deep veins in your leg, usually in your calf or thigh. This can cause pain, cramps, swelling, warmth, or redness in your leg. You may also notice that your leg feels heavy or hard to move. If you have leg pain or cramps, you should see a doctor as soon as possible. You may also experience other symptoms such as skin discoloration, ulcers, or varicose veins. Do not try to massage or rub your leg or apply heat or cold to the area. You need medical attention to diagnose the cause of your symptoms and treat the blood clot before it travels to your lungs or causes long-term complications. 6. Arm pain or numbness. Arm pain or numbness can be signs of a blood clot in your arm, also known as an upper extremity deep vein thrombosis. This is a rare but serious condition that can cause nerve damage or a pulmonary embolism. An upper extremity deep vein thrombosis occurs when a blood clot forms in one of the veins in your arm, usually in your shoulder, elbow, or wrist. This can cause pain, numbness, tingling, swelling, warmth, or redness in your arm. You may also notice that your arm feels weak or hard to move. If you have arm pain or numbness, you should see a doctor as soon as possible. You may also experience other symptoms such as difficulty gripping objects, changes in your skin color, or bulging veins. Do not try to massage or rub your arm or apply heat or cold to the area. You need medical attention to diagnose the cause of your symptoms and treat the blood clot before it travels to your lungs or causes permanent damage to your nerves. 7. Sudden facial drooping or difficulty speaking. Sudden facial drooping or difficulty speaking can be signs of a blood clot in your face, also known as a facial paralysis. This is a rare but serious condition that can affect your facial muscles, nerves, or blood vessels. A facial paralysis occurs when a blood clot blocks the blood supply to your facial nerve, which controls your facial expressions, movements, and sensations. This can cause one side of your face to droop or become numb, making it hard to smile, blink, or speak. If you have sudden facial drooping or difficulty speaking, you should call 911 or go to the nearest emergency room immediately. You may also experience other symptoms such as drooling, tearing, or hearing loss. Do not try to drive yourself or wait for the symptoms to go away. You need urgent medical attention to dissolve the blood clot and prevent permanent facial damage or other complications. 8. Unexplained bruising or bleeding. Unexplained bruising or bleeding can be signs of a blood clot in your blood vessels, also known as thrombocytopenia. This is a rare but serious condition that can affect your blood's ability to clot and heal. Thrombocytopenia occurs when a blood clot destroys your platelets, which are the cells that help your blood clot and stop bleeding. This can cause you to bruise or bleed easily, even from minor injuries or without any apparent cause. If you have unexplained bruising or bleeding, you should see a doctor as soon as possible. You may also experience other symptoms such as petechiae, which are tiny red or purple spots on your skin, or purpura, which are larger patches of bleeding under your skin. Do not try to self-medicate or ignore the bruising or bleeding. You need medical attention to diagnose the cause of your symptoms and treat the blood clot before it causes severe bleeding or infection. Blood clots are serious and potentially life-threatening conditions that require immediate medical attention. If you have any of the warning signs of blood clots that we have discussed in this blog post, do not hesitate to seek help and get treatment. You can also reduce your risk of developing blood clots by staying active, drinking plenty of water, avoiding smoking, and following your doctor's advice on medications, supplements, or lifestyle changes. Remember, blood clots can be prevented and treated if you act fast and stay informed. Share with us your experiences and opinions in the comments below. Thanks for watching.